Okay, let's get started. Happy New Year, everyone, and welcome to our first 2019 Mastermind meeting. I am super excited to share what we have planned for this coming year. As many of you know, we rolled out the Facebook group. You should have gotten an invitation to join. Please, if you haven't gotten an invite, then you could just search on Facebook for Medical Billing Company Owner Mastermind, request to join, and we will accept you. This is a very closed, exclusive group specifically for medical billing company owners. We're going to post events, communicate with one another, and the Facebook platform will help build relationships and create a sense of community. So, as many of you know, I owned a billing company for 13 years, and there were many times that I felt alone and isolated, and whether it was finding the right employees or dealing with difficult and demanding clients, coding, industry changes, competitors competing on price, and obviously the list goes on. What helped me most during that time was the friendships that I created with colleagues and other medical billing company owners. We were there for each other. We traveled to conferences together. We strategized, shared ideas and hacks that we discovered. And this year, I would like to give that to you, a network of friends and colleagues that are there to help and support one another. Our new goal is to help 1,000 medical billing companies thrive. And we really want to get behind this because when our clients and our medical billing company as a whole, as an industry, is successful, then we all succeed. And that's something that we're very excited about. To add to that, we're bringing the masterminds to a city near you. So on February 12th, we will conduct a mastermind in Dallas, Texas. If you live in Texas or you're going to be in Texas on that day, please come join us. We're going to have lunch, and Kevin Ewalt, another billing company owner from Radmax, will talk about strategies he has developed to handle two of the biggest issues facing billing companies today, authorization and credentialing issues. If you haven't already signed up for the webinar, I'll be sending a link to sign up in an email after this session today. You'll also receive a recording of today's webinar. We do have plans to be in New York, Florida, and California. As soon as we firm up the details, we will let you all know. And before I introduce our speaker today, I'd like us all to introduce ourselves, so don't be shy. I would love to see you all make this session a little bit more personable, so please flip on those webcams and say hello. I'll just say your name, and you can just tell us the name of your company, where you're from, and if you want to share a business goal that you have for this year, we'd love to hear that. So I'm just going to go down the list, and I'm going to unmute you guys because everybody is muted right now. Alicia, do you want to introduce yourself? Okay, let's see how we're doing this. No? Okay. How about you, Bob? Unmute. Okay, we cannot unmute Bob. Okay, let's keep going. Let's see if I could unmute you. Bonnie? Bonnie, would you like to introduce yourself?
Yes, I'm Bonnie from Billing Buddies, and I've been in business since 1994. And I really am appreciative of this group that you formed, Chani. It really is, keeps me informed and in LinkedIn, and I like the idea of networking with other billers. So thank you for doing that. What else did you want to know?
Share with us your goals for one business goal for 2019.
What I'm working on is creating flow charts for my belief is that every single claim we submit, there's going to be a response, either in the upfront edits at the clearinghouse, the back end edits at the clearinghouse, or the EOBs. And I want a flow chart of, if it says coverage determined, then we're going to send a statement, that we have a predictable result. If it says need authorization, we're going to email the clinic and have a tickler file so we don't lose track of those ones that we need authorizations on. So that's my 2019 goal.
Good for you. That's awesome. So creating systems and processes. That's great. Okay, Betty, do you want to introduce yourself? Betty Stanford?
Always. So I've been working with her on those. And then all those loan negotiations, I would prefer them to still be emailed to me when they come over.
Let's use some people because
I know how much they will want to settle for.
Right.
oh, gotta mute some people. Okay, Betty, you're there?
Hi, good morning.
Hi. Introduce us. Tell us where you're from and the name of your company, and if you have a goal that you want to share.
I'm Betty Stanford with Stanford Medical Billing Service. I'm located in Fresno, and I also have Nisha McKelly and Linda Sabala joining us on this call.
Awesome. Okay, well, feel free to flip on your cameras if you have them so we could see you as well. If not, it's okay too. But tell us if you have any 2019 resolutions, business goals.
Oh, you're putting us on the spot.
No, I'm not. Okay, let's move on. Next time.
That might take a while.
Okay, well, thanks for coming on the call, Betty. I appreciate it. Okay, let's move on to Jim. Hold on, let's unmute you. Okay, Jim, you want to introduce, tell us about where you're from, name of your company?
Yeah, this is Jim Malloy. I'm a global health management. Been around for over 20 years. I'm out of here in Pennsylvania on the East Coast. When I look at a business goal, probably my primary business goal for 2019 is to really niche out my services a little bit. You know, this day and age, you can no longer be a jack of all trades. It just does not work out. You have to be a master of something. And our company is very data centric, and we handle a lot of the ambulatory side of the business, anything sitting on or around the ASCs. And I really want to try and niche that even further because I think that's really what the need is out there. And with so much competition being out in the industry, which is driving costs down so far, and all of those kind of concerns that are out there, I think that is truly the key moving in 2019.
Okay, that's awesome. That's great. So ambulatory surgery center billing is where you're at, is what you want to focus on. So
yeah, anything in the ambulatory side and in areas like that, absolutely. I mean, we handle a lot of, we do handle ASCs now, and you know those products sitting on top of it, like all those specialties. But I think it just has to be more defined than that.
Okay, so if anyone gets a referral and doesn't do ambulatory surgery billing, send them to Jim Malloy. Okay, Jim, good to have you on the call. Megan, would you like to introduce yourself? Wait, let me unmute you. Cannot unmute you. Okay, the problem with logging in through the phone is that I cannot unmute you, so unfortunately, I will just have to say hello. Ramesh, how you doing?
Hi.
Okay, Ramesh, you with us?
Yes. Honey, can you hear me?
Hi, yes, I hear you.
Hi,
Welcome.
everyone.
Happy New Year.
Happy New Year to you too. So, yes, I'm Ramesh, basically located in the suburbs of Washington, D.C., focused on multiple specialties. Goal for 2019 is obviously more streamline my services and customer growth.
Okay, great. Marketing and growth. Awesome. Okay, Rick. Hi, Rick.
Hi, John. How are you?
I'm good. How are you? Okay, so Rick, I know you're in Salt Lake City, right? Or Utah.
Yes.
Okay, Rick, tell us about what you have planned for 2019.
Well, our company has always focused on the renal industry, doing billing for dialysis facilities, nephrology practices, and interventional nephrology, which then branches out into vascular access. So our goal for this
Rick, we're having a
year-
hard time hearing you. Little hard time hearing you.
Okay. Is this any better?
Little better.
A little better. Okay. Our company has always focused on the renal industry, billing for dialysis and nephrology. We've been branching out into interventional nephrology and vascular access. Our goal for 2019 is to take on an additional specialty. And right now, looks like podiatry and dermatology are our best bets. In 2018, we brought on more new clients than we ever have. And so our goal this year is to exceed that by at least one.
Awesome. Great goal. Business growth. I love it. Okay. Thank you, Rick. Thanks for being on the call, and I hope that you get benefit from this one. Let's do we have a couple more intros, and then we'll get right into our special speaker for today. Bob sent me a message, Bob Burley, that he's traveling, and so he's with us. Thanks, Bob, for being on the call. Although I cannot unmute you, we're happy to have you here. Brandy, are you there? Brandy Cooper?
Yeah, I'm here.
Okay, would you like to introduce yourself?
Sure. I own Evergreen Billing Solutions in Salt Lake City, Utah. And I started this company about 2 years ago after being a certified coder for the last 12 years. So our goal is to just keep growing our client base and give practitioners the ability to, have an EHR and a practice management software that they can rely on that's easy to use and user-friendly.
Okay, sorry about that. Yes. Okay.
And keep their denials down to a minimum. Like, we've been able to get it down to 1% or lower. So that's our goal to keep doing, and give personalized family, make them feel like they're in a big family and taken care of. So.
Okay, great. Awesome, Brandy. And I think we have Ruth Freeman with us. I don't know. Let me see, Ruth, if I can get you unmuted here. Hi, Ruth.
Hi, can you hear me?
No, there's like background noise. Okay, I'll introduce you.
Okay.
I know Ruth is in Tennessee, Franklin, and Ruth is a dear friend of mine, and I'm so glad to have you on the call, and I'm sure that you have amazing plans for 2019 because we talk often, so excited to have you with us. Okay, without further ado, I want to introduce you to, let me turn this on. Okay, here sitting with me is Sean Kanaka. We are in Scottsdale, Arizona today. And here, let's turn it like this, and so I want to just talk about the first time I met you, Sean.
Sure.
So Sean and I first met, I had just sold my billing company, and Sean called me and said, I'm getting one of your clients, which obviously I sold the company and was not supposed to really lose any clients, but this was the one client that we lost, which was fine. And you said to me, let's just meet, let's just have lunch. And it was so nice, and you were such a gentleman. And it turned out that Sean, started working with us at 4D Global, and it was a really good experience.
It was.
So
it was very good.
The message of the story here is that sometimes when you're unsure about a situation, always meet someone. You never know, right?
Yes.
And it's been a great relationship for many years. So thanks, Sean, for being here. Okay, I'm gonna turn on the slide deck, and we will get started. Okay. Here we are. Okay. Good.
Hello and good morning, everybody, and Happy New Year to everybody. So, is there a confirmation where everybody is able to listen?
Yes.
Yeah,
everyone
everybody
can,
is, right?
Everyone can
Okay.
hear you. If
And
anyone cannot hear, they can type their questions in here.
Okay, good. Yeah.
Okay.
Okay, good.
Oh, and also before you start, Bob just sent a message on the chat. would love everyone to join us in New Orleans. I know I'm going to be in New Orleans at the Bob and Dave MBEC conference this year. So if you want to see all of us, specifically me and Bob, and whoever is going to be at the conference, we can share that on our Facebook group. So yes, Bob, I will be there, and hopefully some of us on the call will be as well. Okay, go ahead, Sean.
Thank you, Hani, for the wonderful introduction. And it's an honor and a privilege to be presenting to my fellow colleagues. I hope I'll try to make this presentation brief and crisp and convey the message across. And hopefully we'll all get to network together better as the year progresses. One of the challenges we have always faced is billing companies, they don't talk to each other. They see each other as a threat to each other, which is very, very, very far from the truth. And the reason I say that is, we have to, like other industries, we have to learn and grow together, learn from each other, and there will be enough business for all of us. Today, I'm going to share with you, what we do, which we believe is a little different from traditional RCM company, and how we have managed to grow where we are today. And not just grow, but the key for everybody is how do we retain our clients. And just make a two-line introduction of myself. I'm one of the 3 partners at Unislink. We are based in Arizona. We have, where is page down here? Sorry, next deck. Oh, this one. Sorry,
Yeah.
Okay, good. Which one was it? This one? Yeah. Okay, thanks. So we are, who are we? We're a complete end-to-end healthcare revenue cycle management company. We do, in fact, RCM is just one of the things we do now. And that's what the focus of this presentation is, that how do we enhance our value add to our clients, because more services we provide to them, more stickiness they have with us. You can possibly see from your visits to your clients that medical practices are often, their biggest struggle is to retain people at the front desk, and they're basically back-end support staff. The more services we provide for them, which will help them streamline their operation, increase their profitability, and increase their revenues, the better we are all positioned to retain them as a client. So on top of medical billing, which we started doing back in 2004, in the last 10 years, as we saw the growth of EMR, we got into electronic health records. We tied up with different vendors across the nation to help the practices implement EMR systems and support the EMR systems. The next step was data analytics. We have now access to the clinical data. We have their RCM data. So what do we do with that data? How do we use that data to help them understand the profitability of their practice, how to increase their revenues? Now, the latest thing is population health and value-based systems. I'm sure you've heard all these buzzwords, but how many of us do actually know what they mean and how it's going to change the provider revenue cycle in the next few years? We all know Medicare is making a big push towards not just fee-for-service anymore, but value-added payment systems. They want to see performance. There won't be any payments just related to CPT codes. So you have to help the doctors understand how to report to Medicare, and that's basically the value-based systems and pop health services. I can skip the next line. We provide billing services. K-Tracker is our preferred web-based system, which is an integrated EMR and medical billing system. We help practices implement that. We train the office staff to use it and the clinicians to use the clinical side of things. But we have now branched into several systems, which this is not the context right now to talk about that. 50% of our business is primary care practices, and that's where a big focus on population health and value-based payments is. And that's where is a tremendous opportunity for all of us to increase our client base by offering these value-added services, which typically traditional companies are not able to offer. In 2015, we developed our own indigenous intelligent care management system. What that means is, we have a, can you hide this, the screen? Yeah. Right, yeah. Go back one more slide. So I'm going to talk a little bit about our intelligent management suite, which is basically our population health and value-based system. And also, Hani asked everybody what our 2019 initiatives. Every year we need to reinvent ourselves. Things are changing so rapidly in this industry that, unless we reinvent and we keep reaching out to our providers and show them how we are different and how we add value to them, it's going to be a challenge to retain them as a client. Just in the last 3 years, we have doubled our revenue base and our client size from about little over 200 physicians to now we service little more than 500 providers all across Arizona, and now we are beginning to serve practices in other states as well. So we have a corporate motto to retain clients: educate, empower, and engage. These are not just the buzzwords. When we say educate, we give constant feedback to providers on their coding patterns. We tell them, where they're doing wrong, and we use benchmark analysis to compare their performance with their colleagues, because most often they ask you, how are we doing compared to others? Are my collections on par with others in the same specialty? So benchmark analysis goes a long way. Empower is basically all these tools we provide other than the RCM tools. I'll guarantee you, if you are just doing simple revenue cycle management and not thinking outside of the box, you will lose more clients than gain more clients. Because remember, we are competing against Athenas of the world. They are providing with all these population health tools and more tools for the doctors, not for them to leave them. A lot of us are able to retain clients. For the biggest reason we retain clients is we are local. Our RCM industry is very, very relationship driven. They want to see your face periodically. That goes a long way. But then you top it off with all these additional tools I'm going to briefly talk about. You have a win-win situation. And then after Empower, I said engage, because if you have all these tools, it's of no use if you're not engaging your providers with those tools. Find constant ways to have your account managers and all the way to the owners go and meet clients on a regular basis. You learn so much from if you're just sitting in the office and not meeting them and talking to them frequently, no news is often not good news. And when you go meet them, you will know what frustrations are happening on the back end. Find ways to engage with them. And these are some of the different tools which we use to engage with them. So I was talking about our technology and our population health. In 2015, we became one of the first RCM vendors nationwide to be ONC certified, which in layman terms means, and now we are actually a qualified Medicare registry as well. All the things which we need to report, which I should not say the providers need to report to Medicare and on their data and population health, you need tools to report to them. So this is, it was a laborious process. You have basically IT certifications and all the bells and whistles, which again is not the main theme of this presentation, but just wanted to share where we came from. So what you have something. So what I was going to talk about in this slide is how do we position ourselves for value and outcome-based payments. You know, I can't stress enough that if we are not participating in population health reporting and at least helping the providers in making sense of their clinical data and how their patient outcomes are going to change, how they're going to get paid or reimbursed in the next several years, if we are not knowledgeable enough on that, we won't be able to educate the providers on that. You know, so what we do is through our EMR technology, we have the clinical solutions. Through our revenue cycle management, we have the financial solutions. We have all the data pertaining to their billing. And then we have these analytical solutions, and we integrate all of them and provide a tremendous value add to the practices. Now, this slide actually captures an essence of how we all need to go from where we are to where we aspire to be. On the leftmost graph here is what most of us do currently, and we used to do, like I will say, 5 to 6 years ago. This is focus on fee-for-service billing. That's all we were doing for the most of our lives, and most of us still just do that. We could still do a fantastic job in their AR. Our 120-day bucket could be 5% of your total AR. And this traditional billing company will do a good job on that. But what does that do to the practice bottom line? At the most, you can increase and you can make a difference of 3 to 5% to their bottom line. You know, if the practice is well managed, they have a good front desk, they do their authorizations, referrals, you know, all these things, then there is very little we can do other than fight insurance companies on the AR. And we all have to acknowledge the fact that it's becoming easier and easier with the EMR systems for the providers to capture billing on their side. And we often get questions from the doctors, hey, you know, we are doing most of the work. Why are you charging us 6%, 7%, whatever we charge them? That's where we need to show our additional value. So the second pie is, okay, what's the next step we can go from fee-for-service? Focus on fee-for-service, productivity, effectiveness, and efficiency. What do we mean by productivity, efficiency? I'm going to explain that in the next slide. But the third pie, which is the transformational gains, this is where you can really impact a provider's bottom line. We all know if the doctors make more money, we make more money, everybody's happy. So that's where the focus of this talk is going to be on the transformational gains, 25 to 50% impact plus the value of their practice itself. You know, if a clinician is doing and implementing all the measures for population health and they're well positioned for their value-based payments, the insurance companies have better contracts with them, which means better money for them.
Could you explain population health to
everybody?
Yeah.
I will. Yeah. Sohani asked, can you explain population health to everybody? If I have to explain that in like 3 sentences, what it is doctors see the patients, we bill for the patients, the doctor gets fee for service, and it's done. On the back end, the insurance companies are actually gathering all the data, and Medicare especially now, and all the companies will follow Medicare in future, are saying, okay, you're billing all these CPT codes to us. What is it doing to the patient? Why? Show us data that this, because of your better care to the patient did not get hospitalized. Medicare is looking very, very closely at the hospitalization rates because that's where a bulk of the healthcare system money is spent. If the patient gets hospitalized, Medicare has to pay a lot of money, and if the practices show the clinical data that we were proactive in calling the patients back, the ones with chronic conditions, back to a clinic, so that we could take care of the situation before it became worse enough and the patient gets admitted to the hospital. Right. So you cannot help a physician with that data unless you have a population health system implemented with the practice.
Okay, but let's speak to this, right? Like dermatology is not affected by this.
Yes.
So let's talk about the specialties first that are primarily affected by these. So
Yes.
obviously primary care is
Yeah.
big one, internal
So
medicine.
primary care is the biggest one. You cannot get away. All the billing companies here today who have a lot of primary care doctors, you really need to get the ball rolling on population health. Otherwise, you will be caught off guard and their EMR vendors will take your business away. And it's not just primary care. Think of any chronic medical conditions. Endocrinology. Endocrinology. Okay. I mean, most patients who have chronic endocrinology issues, they don't see their primary doctor anymore. Endocrinology is one of the specialties where there is a high level of reporting needed going forward. Kidney, nephrology, it is these are all chronic. To an extent, cardiology, to an extent, neurology. So it's touching all the practices, all the specialties, but more some of them than the others. Things like pain management or ambulatory service surgical center, like one of our colleagues does, they're not as impacted as others.
Dialysis is also.
Dialysis is nephrology. So it is. So I'm going to talk a little bit briefly on that as well. So this is the second pie I was talking about. What do we do other than just the fee-for-service billing, which helps them increase their bottom line, which is, most of the billers, we are not as financially savvy as we should be. What we are used to doing is at the end of the month, you go to the standard report from the billing system, you print that report, you PDF it and send it to the client. Most clients don't make sense of those numbers and those reports. What else do you do? Do you analyze those numbers for them? Do you, we go like 2 steps ahead. We actually break down their CPT distributions. We compare their CPT distributions with the practices nationwide. And we tell them, hey, doc, you're doing way too many level 4s for your specialty. This is a national average. Watch out for audit flags. Now, we developed our proprietary tools. We have our web-based reporting systems where they go and they can see their coding distribution patterns. And if some practices are doing way too many procedures, just to enhance revenue, but does the patient actually need those procedures? This goes back to client engagement. Are we making sense of the data to go and talk back to the client and making sense for that data? And one of the biggest success for this is that the smaller the practice, the less in tune they are with the analytical side of things. If you want to grow from 1 to 2 physician practices to 5 to 10 physician practice groups, this kind of data and this kind of analysis becomes all the more important, because they usually have a practice manager or an administrator who is an MBA or who understands the business side of things, and they will understand the data much better than a doctor. So if you want to expand your client base to larger practices, data and analysis becomes even more important. Check reimbursements against contracted values. I'm sure a lot of us are doing it, but our web-based tool automatically tells the providers, compared to Medicare, how much are their other payers paying? And this specific data, our providers gave us raving feedback on, wow, we've never seen this from our prior billing companies. We analyze their contracts and we tell them, hey, Cigna is paying you only 80% of Medicare. Have you ever bothered to go and talk to your provider rep and see why? Now a provider rep will come and meet you, and your chances of getting a better contract with that payer is if you have data. That's where population health also comes along now. Okay, we can pull data from our system showing our population base had 20% less hospitalization rate compared to like your average in the area. Things like that. This is all a data-driven world now. One of our colleagues who was on the call earlier, who introduced himself, was it Jim, I think. He nailed it. He said, we, for 2019, they want to become more data-centric. We want to compete against the big guys. We not only just gather the data, but make sense out of it and present it to the practices. And, reporting, PQRS reporting, we probably, a lot of us has seen that a lot of our practices, the doctors begin to see 2% reduction in their payments, and they freak out. They say they were caught off guard. But we were able to avoid that by being more proactive, and we helped our practices meet all PQRS goals so that they don't get penalized. Not only they don't get penalized, they'll actually get a bonus. And that's where they will really appreciate your value-add services other than traditional RCM. And the third pie, which is probably kind of rocket science for a lot of us, but this is what is going to drive the future of RCM and our future as RCM companies, is population health. A little bit more than data analysis is actually you're going from analyzing the financial data to analyzing the clinical data, and billers are not trained to do that. That's why when we hire resources, you need a better skill set among your staff, not just those who are entering charges and posting payments. You need people who understand the clinical side of things. We now have, obviously RCM is bread and butter for all of us, a very robust RCM team, but then a pretty robust product and pop health team. They're trained to understand the clinical data. And, because this is the data which people are going to use in future, the doctors are going to use to avoid penalties and get bonus payments. It goes hand in hand. There is, and also when you present the clinical data, you have better chances of getting good value-based contracts from the payers. You can help the practices do that. So when you're engaging your practices at so many levels, helping them understand where all you're adding value to them, I can guarantee you, even if there is a small misstep on billing every now and then, the AR goes high, the client is unhappy, but you're doing so many other things for them that they'll find it very difficult to leave you. And so let me summarize what I was just saying in the previous slides is understanding patient population, aggregating data from a clinical system and financial systems, then define the care pathways, stratify population and define care pathways and applicable quality measures. These are the quality measures which the insurance companies are going to use to give you an additional payment. Not just that, a traditional fee-for-service model, let's say right now your most commonly used code in an office is a 99214 for a follow-up visit. You get paid, let's say, $105. 2 years down the line, Medicare will only pay 70 of those dollars. The other $35, for those who are very passive, they're not going to get. They're going to get a penalty, and they'll say, this is all you're going to get because we don't have any other data supporting the patient outcomes. Then identify care gaps. By identifying care gaps, that is where this ties up with the chronic patients in the practice. Identify patients with chronic. Medicare has published the chronic conditions, hypertension, obesity, all these endocrinology conditions, kidney conditions. So you can flag the patients for those, and then you can report to the practices back to them. So, and then engage patients. This is the true definition of population health, honey, in terms of dollars. Okay, you identify patients with chronic conditions. So what do? You reach out to the patients. Patients has hypertension, and Medicare requires those patients to be followed up every 6 months, or they have a calendar for these patients depending upon their BMI and things like that. You help the practices achieve those metrics, and you have to reach out to the patients proactively and tell them, hey, you are due for follow-up. Patients do not see a doctor unless there is a symptom. But the future is, to avoid the symptom, you have to go ahead and plan your schedule, just like your annual physical exam. You don't have anything going on, but you still go see a doctor. So these patients with chronic conditions, they need to go see the practices. Well, guess what? It's a win-win. The patient comes back, it's more appointments for the practice, more money for the practice, and then you have you're documenting their health records more frequently, which will be used for your population health reporting.
Okay, so do you charge do you think it's a good practice to charge for making those appointments?
Yes. So here is the thing, correct. So that's exactly what I was saying. Engage patients in this slide. So we identified the patients for the practice, and we told them, it's a drain on you to go call these patients. So we tied up with a large telecom company, and we had them integrate to our clinical and RCM system. And we told them, okay, we have identified the patients, we got to go ahead from the practice, and we reached out to the patients through automated calls, saying this is the doctor's practice calling. You're supposed to schedule an appointment, press 1 to schedule an appointment. When they press 1, that's when the call gets routed to the practice and they're able to schedule an appointment. And we actually have some data for 2017. We just wrapped up 18. It's even more robust for 18, but I'm going to show you that data on what it translates to in terms of the actual money. This is just one screenshot of our proprietary intelligent care management system. What I think all you can see is graphs here, but I'm just going to tell you what this is. Any practice which has enrolled in our Pop Health system, they will see this in their dashboard on a daily basis. This is telling a practice, the first slide is telling the practice that 71% of the patients are due for an annual physical exam. You will be surprised. Many practices don't have a good system of getting the patient back in every year. That's easy money for the practice. There is no copays or no deductibles, more appointments for the practice. And insurance wants you to do it. They are paying you full money for the patient to get your annual physical done. So why would you not do it? Practices don't have the tools to do it. So what we did is we identified those patients and we told the practice, we'll make the calls for you, automated calls. And guess what? Some of the practices who are a little reluctant in the beginning, we told them we'll do this free of cost. Let us prove this model to you, because we were so sure that it is going to work. Once we screen our billing system really good, that, okay, when was the last physical done? It was done in December 2017. Okay, we are into January 2019. This patient is due for a physical. Let's call. And we developed a message, which is an automated voice recording with full approval from the practice administrator, saying that this is the content of the message. This is your primary care doctor calling. You are due for an annual physical. Press 1 to schedule an appointment. And what this practice did, this was a large 20 physician group. They had a dedicated phone line which will receive that call when the patient press 1. Because then they can see, okay, we did this campaign. How many appointments did it result in? It resulted in so many appointments in just 1 month that they put the program on hold for 2 weeks because they can't take so many patients. But guess what? The revenue shot up. They were delighted, So when you prove this concept to the client, they will pay you for your services.
Okay, so after that, what's a good payment structure?
So after that, we integrated that model, and we are into a payment system now from our physicians where the doctors don't like to be nickel and dimed. Okay, let's say you were charging them 5% of your collections. We'll say, okay, now we are doing all this for you. You're getting a free population health system. You have the room to increase your collection rate to 5.5% to your 6%. So you show value to them. Doctors are very difficult to sell to. They have vendors knocking their door every day, bringing them free lunch every day, telling them we can do this for you, we can do this for you. They will not do it. First of all, they don't have the time. They won't do it unless they see the proof in the pudding.
So you were able to raise your percentages.
We were able to raise for a couple of them, yes. Some of them, the impact was not as significant, so we did not feel right. But guess what? The main agenda for today is how do we retain clients? So just think about it. If we are doing all these things on top of their RCM, what is the chance of they leaving you if they are tied to you in so many ways? It's like a stickiness.
Or also knowing they have the option. Right?
Yes.
Whenever they want to turn that piece on, they
Right.
know they have it versus they may not have the same advantage from a competitor.
And to be honest, a lot of these practices have their EMR vendors offering these services, but they will charge them for every piece of that. So how do we differentiate ourselves is that we will first charge less than they do. If their EMR company or some other vendor is, we are doing like patient call reminders now. That's another way to add our services. And everybody has a cell phone now. People check their texts way more frequently than their voicemails. So we are enrolling this text reminders to the patients. And it costs you way less than what other vendors are charging. So you just add a little bit of margin. Remember, the goal is for these value add services, you don't lose money, you make a little bit of money, but you make that up on the RCM side of things.
Right.
By structuring your reimbursement model and showing these value add services. So these pies, which I was showing you here, it's not just physical exams. We are telling them, these are 83% high risk patients, and we are actually showing them how many patients they are there. And we have all these different metrics. These are the patients with diabetes, which you haven't seen. These are the patients with hypertension you haven't seen. And when they click on this patient number, they can actually go and see those patients, and they can choose to either call the patients themselves or use our services to get their appointments.
Okay. So if a billing company wanted to get this add-on service, tell us. Oh, well, go ahead.
Yeah, I'll talk about that a little bit towards the end. I wanted to just let other companies see there is so much more you can offer to your clients. So in a nutshell, what this slide is showing you is that all the services we do right now, most of us, what we do is in the green box, which is operational effectiveness, timeliness, accuracy, AR follow-up. All the billing companies do it. But these are the other three blue pies there, which you can see, increased productivity, more visits, more complexity, higher payer reimbursement from better patient outcomes, participating in value-based and risk contracts and analytical insights. These are the other things which we do on top of your traditional RCM. And I think I just have one more slide, and this is the result summary. This is the actual data from 2017, and that was one of our first years we've deployed our tools across our practices. And 2018 is way better than this, but we're still compiling the data yet. Our software initiated over 200,000 care alerts to high-risk patients in 2017. The purpose of the calls was to engage patients to contact the office and seek an appointment, and that resulted in almost 30,000 appointments made, yielding a 15% response rate. These appointments, and last year it was even better. This was the first year. For a first year, it was a very good results for us. And these appointments resulted in fee-for-service revenues to the tune of 2.48 million in addition to the reduced care gaps and improved care outcomes. It's not just the dollar. Yes, this is just for our clients. And the revenue impact from higher fee-for-service reimbursement translated to an average increase of $60,000 per doctor. Just imagine, on average, a solo doctor's revenue is like $350,000, unless they're crazy seeing patients 7 days a week, a year. $60,000 on top of that is a pretty good cheese for them, and that's directly after all their costs. This is like minimal cost to attain that revenue. So it's like a financial win-win for everybody, including the clients, For us, they make more money, we make more money. Most importantly, we retain the clients, and we are all in a cutthroat industry right now. We find different ways to, keep, in spite of all this, we still lost a few clients because of other reasons which are beyond our control. There's practice consolidation, things like that, vendor change, EMR changes, they decided to go with their things like that. But if if your goal is to expand your horizons from smaller practices to larger practices, right now, I mean, the only reason we jumped from 250 providers to 300, 500 providers in just 2 years is because we managed to get some large groups. And the large groups look at these kind of things. They want to stay ahead of a solo practitioner because they want better contracts from the payers. And how do you get better contracts from the payers? By deploying population health tools and showing them all the data which they want to see. Because insurance companies are also big data players, and they are the data aggregators.
Awesome. Wow. That's really great.
So yeah, I think that's all I had. And I just want to cap it up by saying that we have started helping other billing companies because honestly, you need a lot of expensive IT resources to develop these kind of tools. And most of us, we are trying to focus on our bread and butter, and we don't have room to hire those kind of resources. We were fortunate enough to go that route because we had a significantly installed client base from our EMR client base to go take a shot at this. And we invested a lot of money in year one. You don't make any money. You just invest hundreds of thousands of dollars and then you expect the best results. And then you go and show the value to the clients because you have to be convinced that this is the future. If you're not, if you're waiting for things to happen, you will realize that it's too late for you. You will lose your clients, And we're happy to, we have at least few vendors who decided to use, this is like, we are in no way threat to them or their clients. Their clients don't even see us, but they use our system as their backend system. And they provide this system to the physicians,
So you white label.
They white label it. And they don't even know who we are because we train our other billing vendors to use the system, and obviously we don't talk to them. They are the ones who are talking to them, and they are the ones deploying these tools to them.
Okay, so it's just a licensing thing where they would
Right.
do something.
We just have an agreement with them that okay, we charge you this much.
Okay.
They can do their own billing. They could just use our product.
Okay, so give us an idea of what softwares you would integrate with, like this product. would
We
integrate
are,
with
yes, our intelligent care management system, which is our population health system, it is system agnostic. It integrates already with our system, which we use. Our preferred system is CareTracker. It's a 100% web-based system, and we have some billing vendors who use that just for their RCM. And you'll be surprised. The cost for that per provider is almost the same as what you pay your clearinghouse. And this comes with an integrated clearinghouse because we have so many providers now. We were able to negotiate a very good rate with them.
So you're saying specifically with CareTracker is what this works with?
No, eClinicalWorks is another big system out there. So our system, our population health system works with eClinicalWorks.
Okay.
With all these investments we made on population health, our largest win was an ACO. We managed to get an ACO client with hundreds of physicians. So even though we are directly servicing 500 doctors now, we have more than 5,000 providers who are using our systems, either through other billing vendors or through these ACOs. ACO is all about population health, right? I mean, I'm sure most of our colleagues know, what the ACOs are doing, and they are using our tools to help their doctors meet the population health goals and requirements so that they can present that data to Medicare and get additional reimbursements from Medicare.
So the ACO is using your platform and
Yes.
using it for billing or just
Yeah,
the platform?
no, they're using only the population health side. And this is the largest ACO in Arizona, largest independently owned physician ACO in Arizona.
Awesome. Okay, we have a couple minutes left, so I want to just open it up for questions. If you do have a question, there's a, just type it in the question box and I will unmute you and you can have the floor. But let me put the question out there. What are you, what could we share, what could any of you share what you've done that Sean has not mentioned to keep your clients, retain your clients, or keep them sticky, like Sean likes to say. The old school was, we talked about this earlier, old school was like EMR, right? Like you give them a free EMR and that's
everybody's doing
that's
that
over,
now.
right? Like that's not where we're at anymore. So what is it that anyone's doing to keep their clients happy? I know some people are doing credentialing.
Yes, we don't stop at what we are doing now. This year we want to launch authorization and referral management because we've seen that a pain point for a lot of our specialists.
Right.
We see denials because there was no auth opt-in.
But there has to be a fee structure in place.
Oh yeah,
and I think that's
we
the
cannot
biggest
do
question.
that as part of your regular. It has to be based on what is the volume of authorizations needed on a daily basis, because we need to dedicate resources for that.
Exactly.
And robotic process, I didn't touch upon that, but we just developed and launched a tool which is a fantastic tool for doing AR. We developed automatic tools to go and check like 1,000 claims status in one day. If you have a rep calling, she will do like 20 claims a day.
Right.
We have these automated tools which will connect to Medicare and local Medicaid payer systems, and now we just did it with United Health System, I think, where it'll go, it has all the patient fields needed, whatever they need to give you a claim status, and then it'll pull the results back out.
Right.
And it's our AR team loves it. It's their productivity has increased so much because of that.
Right, for sure. Well, they actually know what's happening with a claim. They don't have to
Yes.
always make that follow-up phone call. So that's awesome. Okay, cool, great. I just want to say I'm going to India on Monday. So if anybody wants me to check out something for them or has any questions for me, you could always private message me. I'd be happy to help you. I know, Sean, you're from India. I'm going to a different city, but all good. Okay, so we are going to, if nobody has any questions, we're going to say goodbye and thank you all for joining us. Look out for an email with the recording of today's call, a link to sign up for the next mastermind, and then we have Tim Cardew from Practice Max in March talking about, I think, the credentialing thing is what he's going to talk about. Okay, Bonnie has a question. Let's see. We do billing for allied providers like chiropractic, mental health, speech pathology, and audiology. Does this apply to these specialties?
Yeah, good question. It does apply to mental health for sure. Maybe not speech pathology and audiology. No, definitely not chiropractors. But mental health to an extent, yes.
Okay. And yes, and if you'd like to host a mastermind in your city, if you feel like you have enough people, Scottsdale, not so much. Clearly, Unislink and Practice Max are really the winners in Arizona because nobody else has the time to get out of their office and work on their business instead of in their business, which is fine.
Yeah.
You're just getting all the business. Then please message me and maybe we could put something together in your city if you have enough people that are interested in coming together. Conferences get expensive and it's hard to travel sometimes, so doing these things locally is always helpful. Okay, awesome. Okay, thank you everybody. Happy New Year and hope to see you next month. There will be a survey.
Everybody.
There'll be a survey at the end of this. Please reply to it. Let us know how we're doing and share your feedback. Okay, bye everybody.